All right, so today we're going to talk about TMJ. So very popular buzzword now. What TMJ actually is this joint right here on the side of the jaw. So that's the joint that helps you open and close your mouth. So you're going to be using it a lot every day when you're eating and talking as well. So there's a lot of muscles in the face. They're very, very complex. When you have TMJ, you're going to get a lot of tightness in these muscles, but don't over push, stretch them on your own as you can irritate them. I've made that mistake before in the past myself, pressing and poking, trying to release those muscles just like you would your arm or your legs. They do not work the same, so do not do that. You can actually make the problem worse. As a chiropractor, if somebody comes to me with TMJ, first I'm going to look at how that jaw opens. Is it opening to one side, to the other? Is it zigzagging all over the place? That's going to lead to dysfunction and then tight muscles. So we got to get that fixed. You want to look at the upper neck as well. The upper neck nerves are what actually are controlling the jaw. So if there's any misalignment, head tilting, anything like that that you'll see on x-ray, that can also negatively affect the jaw. Another thing that we want to do is muscle release. So like I said, a lot of people have really tight muscles. Sometimes we do it on the outside. Sometimes you have to glove up and do it on the inside of the mouth. This can be a little uncomfortable for some people, but most people in that situation do not care, because if they get the relief, they'll do whatever it takes, because jaw pain is extreme. And you want to be really, really sensitive with who you're going to and how you're treating it, because you have what's called the trigeminal nerve that sits around this joint. That is a very sensitive area, so you don't want to be doing anything aggressive. Don't have a friend try to pop or crack or snap or anything like that. You want to also get cleared through your dentist. Most dentists are just going to give you an expensive bite guard to protect your teeth. It will not fix your TMJ, but it will protect the enamel of your teeth, which is important. But making sure that you don't have a deep-rooted tooth issue that could be mimicking jaw pain, right? So you want to check your dentist, get a routine checkup, make sure that that's not causing that either. And the last thing that you want to look at, which is something that most people overlook nowadays, is mental emotional stress. Most people's stress is way up here and they're not doing anything to handle that emotional stress. Emotional stress can lead to some people that clench. That clenching is usually done at nighttime. So if you're constantly clenching, you're going to be re-aggravating that injury every single night when you go to bed. The bite guard will protect your teeth. It will not necessarily protect your jaw that much. And I can get in there and realign your jaw. I can release the muscles, but honestly, to be transparent, if you're clenching at night, it's just gonna keep coming back. I'm gonna get bored treating it. You're gonna get tired of paying me. It's gonna be a vicious cycle. So you gotta protect your mentals. We gotta be really, really mindful of our mental health. And that's gonna be different for everybody, right? So there's meditation, there's therapy, there's a lot of different types of things that we can do for our mental health, and I think it's something that we all need to prioritize a little bit more. So if you notice yourself clenching, I want you to check your mental emotional stress first, then go to your chiropractor, then check with your dentist, and kind of get that holistic approach, because you want to know what the cause is before you buy anything expensive or dive into any expensive treatments. Thanks for tuning in. We'll catch you on the next one.